The next classification of antihypertensive drugs, and this is a really important one because I happen to like these drugs. They're called ACE inhibitors. And ACE stands for the angiotensin converting enzyme. If you inhibit that enzyme, certain things happen. You inhibit the conversion of angiotensin 1 into angiotensin 2. It lowers blood pressure and makes platelets a little less sticky. So just to review this for you, we touched on it earlier. What I said was that when the sympathetic nervous system gets into the act, or under certain conditions where the blood volume drops down or the sodium level in the bloodstream drops down, if the person's going into shock, then renin is released from the juxtaglomerular cells here in the kidney. And renin then is going to convert angiotensinogen, which is a protein made in the liver, circulating through the blood, converts it into angiotensin 1. Angiotensin 1 doesn't have much of an effect. But as angiotensin 1 circulates through the pulmonary circulation, there's an enzyme in the pulmonary circulation known as the angiotensin converting enzyme, the ACE enzyme. The ACE enzyme converts angiotensin 1 into angiotensin 2. And then angiotensin 2, when it's being generated, look at all the things it does. It increases sympathetic activity, so the heart muscle contracts with more force. There's more peripheral resistance. It increases the resorption of sodium and potassium from the kidney tubules, increasing the blood volume, raises blood pressure that way as well. It increases the release of aldosterone from the cortex of the adrenal glands. Aldosterone then resorbs more sodium and chloride in the kidney tubules and excretes more potassium, as we saw earlier, so blood pressure rises again. It also increases it causes blood vessels to constrict, more peripheral resistance, and it increases antidiuretic hormone, which is going to reabsorb more water from the collecting ducts so the blood volume increases. So the renin, angiotensin, aldosterone system is in place to raise blood pressure when the body needs to do that. If I can create a drug that will actually block that enzyme, converting angiotensin 1 to angiotensin 2, what I have is an ACE inhibitor. And I bring blood pressure down. The angiotensinogen system basically then is going to be activated. So you're going to increase renin in the first place from the kidney when blood pressure drops, a drop in sodium in the bloodstream in the distal tubules, a decrease in the blood volume, or anything that will cause renal sympathetic nerve stimulation. I want you to think about the number of people you've met already in your lifetime, or you're going to meet, who have what's called, and you've studied this, idiopathic hypertension, also known as essential hypertension. That is, for no apparent reason, this person just happens to have high blood pressure. They're thin, they work out, they have a good diet, but their blood pressure is high. Have you seen this? You've never seen, well, you will see it. So often what's happening behind the scenes, and not in every case, is that the person has, without knowing it, a deep-rooted anxiety issue. On the surface, they seem to function fairly normally, but their brain racing. They often don't sleep well at night. They're a little more hyper-irritable, or they have a little more anxiety than someone else might have. And so they're a sympathetic dominant person, hyperkinetic sometimes. The sympathetic discharge is greater. And it's constantly releasing renin from the kidneys, increasing angiotensinogen too. And they have high blood pressure. So they say, well, let's put them on a drug to bring their blood pressure down. What I'm saying to you is that in many cases of high blood pressure, where there's no other apparent reason for it, very often putting the person into meditation, yoga, visualization, deep breathing exercises, aerobic exercise. Remember what aerobic exercise does? When I'm exercising, my sympathetic discharge is greater. My adrenal levels go higher. My blood pressure increases. But when exercise is over, my adrenal levels go down below the baseline of what they were before the exercise started. And I stop encouraging renin from being released from my adrenal glands. So what I'm saying is that too often the patient's just given a drug when in fact lifestyle medicine and the proper coaching from a complementary practitioner can actually bring that blood pressure down just using mind-body. Even without supplements or dietary change, mind-body can sometimes just stop the over-secretion of renin in the very first place. You understanding this? And it gets ignored. So these are the effects of angiotensinogen 2. We saw them. They increase blood pressure by vasoconstriction, releasing aldosterone. Here's something to point out that's really important. It also increases platelet stickiness. I want to point this out. When you're producing all this extra angiotensinogen 2, it's also upregulating the production of what's known as plasminogen activating inhibitor. So normally, every day of your life, small little clots form in your bloodstream, platelets clump together and fibrin sort of forms, and you have small little clots. The endothelial cells normally secrete plasmin, and plasmin, just like heparin and other fibrinolytic substances, dissolves the clot so the platelets can float freely again so you don't form an abnormal thrombus or develop an embolism. When you have a lot of angiotensinogen 2, not only is your blood pressure going up, but you're inhibiting the breakdown of those clots, and you tend to get a greater likelihood that clots will form in the vascular system that will lead to an event down the road, clogging up the kidney arterioles or causing the risk of a thrombus. So that's a very dangerous situation. And so what you'll see that sometimes ACE inhibitors are used to block platelet stickiness through this effect. So ACE inhibitors are used as antihypertensive medications. They're also used to help decrease those platelets from clumping together and forming abnormal clots. And the angiotensinogen 2 also increases the release of norepinephrine, as we saw earlier, increasing blood pressure that way. So ACE inhibitors are used to decrease blood pressure, obviously, and to decrease platelet aggregation where it calls for that intervention. So in high blood pressure, what really stands out in the research is how effective ACE inhibitors are in diabetics who have high blood pressure. At not only bringing their blood pressure down, but ACE inhibitors help to decrease the progression of kidney disease in a diabetic. The primary reason that a person is likely to require kidney dialysis later in life is because they develop diabetes. Diabetes increases the propensity for plaque to form in the artery wall, narrows the blood vessels in the kidneys. You can have less things filtering into the kidneys, so toxins build up in the bloodstream that can be life-ending. So now when you have this much renal failure, then all of a sudden you need dialysis or a kidney transplant. Having diabetes escalates your risk for these complications to an astronomical degree. And so ACE inhibitors have been shown to help decrease the progression of kidney failure in a diabetic if they have high blood pressure, and often even in a diabetic who doesn't have high blood pressure, using ACE inhibitors are often used just to block the progression of kidney disease. And so that becomes one of the secondary modes where it applies even for people that don't have high blood pressure, to stop diabetic nephropathy from progressing. Also in congestive heart failure, they're used. And if a person's already had a heart attack or a major vascular event and they don't want clotting in the blood, in the vascular tree anywhere, they will often, even if their blood pressure is not high, put them on an ACE inhibitor, just so you understand it. You're going to see people who've already had a heart attack, excuse me, they have their blood pressure is normal. You're going, why is this person on an antihypertensive drug like an ACE inhibitor when their blood pressure is normal? It's because they want to block the clots from forming that may create a secondary event in a high-risk patient. That's the reason. The thing about ACE inhibitors on the negative side is that that same enzyme in the lung, that in the pulmonary circulation, the ACE enzyme is also needed to break down bradykinins in the pulmonary system. If you can't break these bradykinins down, they become an irritant to the mucosal lining in the lungs and bronchial tree, and the person then has this irritation and they develop a very dry cough. So 20% of people who go on ACE inhibitors end up with a dry cough that makes them totally insane. That's the major adverse side effect. It's the one that I want you to remember. Other than that, they have an excellent safety profile. The ACE inhibitors often end in the suffix "pril," as you can see. So captopril and ramipril or Altase, very, very popular ones. But when you see pril at the end of a drug, you pretty much know you're dealing with an ACE inhibitor. And just as a prelude into what we're going to see later on, remember that, and I taught you this last year, that the herb hawthorn has natural blood pressure lowering effects. Just to highlight how some of those effects work, the active constituents in hawthorn act as natural ACE inhibitors to some degree, and they also have an effect on the inotropic effect on the heart and on dilating coronary blood vessels by releasing more nitric oxide. So hawthorn as an herb has more of a gentler effect along these similar lines, as we'll see later.